We're only a few years into the 21st century, and what used to be considered alternative healthcare is now mainstream, and the advances are remarkable. We're about to meet Dr. Marc Darrow, who teaches prolotherapy at UCLA and has his own practice here in West Los Angeles. So, Dr. Darrow, what exactly is prolotherapy?
Well, prolotherapy is the simplest thing in the world, and that's why it works so well. It very simply follows the body's dynamics naturally in a healing fashion. So what we do is we stimulate the immune system, we bring fibroblasts to the area, which are little cells that produce collagen and cartilage, and the body regenerates itself and rejuvenates itself.
Why do you think prolotherapy isn't very wide known?
Doctors are not trained in prolotherapy in medical school or residency in most programs. There's a few that are trained. I am an assistant clinical professor at UCLA, and I teach prolotherapy to the residents there. But the problem is, if a doctor's not trained in something in school, he's down on it, meaning he doesn't know what it is. If he doesn't know how to do it, he's going to say it's no good. So patients are scared away about prolotherapy when they go to their doctors and ask about it, because the doctors almost ubiquitously will say, it can't work, it's impossible, it's too simple. Because all we're doing is injecting sugar water, dextrose, plus a local anesthetic into the area to create an inflammatory cycle that stimulates collagen growth. It's too simple, it can't work, but it does work, and it works on about 80 to 90% of patients.
Now, I understand that a lot of your patients have considered surgery and then come in to see you and have called off their surgery.
Actually, a lot of people come to us the day before surgery, meaning they have an appointment to go into the operating room, and I will plead with them not to have the surgery. I've had people come in with numb legs, with herniated discs in their back this big, 1 centimeter, 1.5 centimeters, and often prolotherapy is really all they need to help them heal. So we get a lot of people that come in with surgery planned, or they are promised by their surgeon that they'll be paralyzed if they don't have surgery on their back or neck, or that they'll never walk again, things of this nature, and they are healed with prolotherapy.
I'm a certified physician assistant, and I've had pain in my left knee for about 2 years. The pain began when I started training for a marathon and was running about 5 or 6 days out of my week. I went to see an orthopedic surgeon who told me, you have to have knee surgery. Told me it would take about another 6 months for me to be able to run again and rehabilitate my knee. So I heard about prolotherapy, I did some research and decided, hey, why not? I don't have anything to lose. So I started prolotherapy. I had 4 injections in my knee and then decided to go test it. I went down to the beach and took about a 7-mile run that day and felt great. So it certainly has made a difference in my life, and look forward to continuing to exercise and run.
Where exactly can we find you?
It's so easy to reach me because my phone number is easy to remember. It's 1-800-REHAB-10, and the website is just as easy. Just add a .com to that, which is 1-800-REHAB10.com. On the website, there's always a listing of the lectures I do around town, and I speak about every 2 weeks at least, sometimes more often at Whole Foods, Santa Monica Library, places like that.
Well, thank you so much. I'm really looking forward to getting my injuries treated.